Welcome back to Golden Wellness Guide. Today, we're going to discuss a deeply personal yet incredibly vital topic: how to recover sexual function and intimacy after a stroke. Many patients and their loved ones feel confused, ashamed, and unsure where to turn. This video is designed to be a starting point, a guiding light on your journey to rediscover closeness and enhance your quality of life. We'll explore the challenges and, more importantly, the solutions. Let's begin by understanding why intimacy changes after a stroke, and how individuals like Michelle, a stroke survivor from New York, navigated these very personal struggles. First, we need to understand that a stroke doesn't just affect walking or talking. It impacts the body's control center, the brain, and often the entire body. We'll explain this simply by looking at three main factors. Firstly, physical damage. This includes hemiparesis or hemiplegia, weakness or paralysis on one side of the body, muscle spasticity, profound fatigue, and even altered sensation in certain areas. All these are significant physical barriers. Michelle, for instance, experienced significant left-sided weakness and persistent fatigue, making even simple movements a challenge, let alone intimate ones. He also noticed a change in sensation, which was profoundly disorienting. Secondly, psychological impact, depression, anxiety, and low self-esteem about a changed body image are hidden enemies that can kill desire. The fear of experiencing another stroke during intimacy also creates immense pressure. Michelle confessed to his therapist that he felt broken and undesirable, and the thought of intimacy brought overwhelming anxiety. Finally, medication side effects. Certain medications for blood pressure, blood thinners, or antidepressants can reduce libido or make it difficult to achieve erection or lubrication. Michelle was on several medications for blood pressure and depression. He initially attributed his reduced sex drive solely to the stroke, unaware of the role his medication played. Understanding these root causes helps us move past blaming ourselves or our partners, and instead, work together to find solutions. Before we delve into specific techniques or therapies, the most crucial step is to shift your mindset. View this as an integral part of your recovery journey. Just like learning to walk or speak again, it requires time, immense patience, and profound empathy from both partners. The silence surrounding this topic is often the biggest barrier. You must openly communicate with your partner. Michelle and his wife, Sarah, initially avoided discussing intimacy, leading to unspoken tension. It wasn't until Sarah gently initiated a conversation, expressing her continued love and desire for connection, that Michelle felt comfortable enough to share his deepest fears and insecurities. This open dialogue is vital. Furthermore, we need to redefine intimacy. It's not solely about penetrative sex. Intimacy encompasses a wide spectrum of affection, caresses, massages, tender kisses, cuddling, and simply being physically close. Through therapy, Michelle and Sarah learned to explore new ways of being intimate. They started with simple acts like holding hands, cuddling, and gentle massages, rediscovering the joy of physical closeness without the pressure of performance. The goal is connection, pleasure, and shared experience, not just a specific act. Now, let's get practical. Addressing physical limitations is key to re-engaging in intimacy. First, consider positioning and comfort. Experiment with different positions that minimize strain on your affected side and provide support for weak limbs. Using pillows, wedges, or even supportive chairs can make a significant difference. For Michelle and Sarah, they found that positions where Sarah could take a more active role, and Michelle could be comfortably supported by pillows, worked best. They also learned that timing was crucial. Morning, after a good night's rest, often provided Michelle with the most energy. Second, managing fatigue. Post-stroke fatigue is real and often overwhelming. Prioritize rest, and consider shorter, more focused intimate sessions. Energy conservation techniques learned in physical therapy can be applied here. Third, addressing spasticity and weakness. Gentle stretching and warm-ups before intimacy can help reduce muscle stiffness. Continue with your physical therapy exercises to improve range of motion and strength, which will indirectly aid in comfort during intimacy. Finally, sensory changes. If you've experienced altered sensation, explore new erogenous zones. Focus on unaffected areas of the body. Experiment with different types of touch, light, firm, gentle, to discover what feels pleasurable now. Michel, for example, discovered that light touch on his unaffected right arm and neck became surprisingly pleasurable, opening up new avenues for intimacy. Beyond the physical, the psychological aftermath of a stroke can be equally, if not more, challenging for intimacy. Firstly, seeking professional help is not a sign of weakness, but a courageous step towards recovery. Consider therapy with a psychologist or a specialized sex therapist, either individually or as a couple. Cognitive behavioral therapy, CBT, can be highly effective for managing anxiety and depression. Support groups, where you can connect with other stroke survivors, can also normalize your feelings and reduce isolation. Michel's therapist encouraged him to join a stroke survivor support group, where he met others grappling with similar intimacy challenges, significantly reducing his sense of loneliness. Secondly, building self-esteem and body image is crucial. Focus on your strengths and celebrate every small progress in your recovery. Engage in self-care routines, grooming, dressing well, to help you feel good about yourself. Partner affirmation is also incredibly powerful. Constant reassurance and love from your partner can rebuild confidence. Sarah consistently reminded Michel of his resilience and celebrated his milestones, helping him slowly regain his self-worth. Finally, managing the fear of recurrence. Discuss your specific risk factors with your doctor to understand when intimacy is safe. Your healthcare team can provide guidance. Relaxation techniques like deep breathing and mindfulness can also help calm anxieties. Medications are vital for stroke recovery and prevention, but some can impact sexual function. It's crucial to have an open dialogue with your healthcare team. Never stop medication without consulting your doctor. Instead, discuss any sexual side effects openly. Are there alternative medications that might have fewer side effects? Can dosages be adjusted? It's important to talk to your primary care physician, neurologist, and potentially a urologist or gynecologist who specializes in sexual health. Michel, with Sarah's encouragement, finally brought up his concerns about his reduced libido with his neurologist. They discussed adjusting his antidepressant dosage and explored options for managing erectile dysfunction, leading to a more balanced approach to his overall health. For specific solutions, if you're experiencing erectile dysfunction, oral medications like PDE5 inhibitors, e.g. sildenafil, tadalafil, might be an option, along with vacuum devices or injections. For vaginal dryness, lubricants, vaginal moisturizers, or low-dose estrogen therapy for postmenopausal women can be very effective. If hormone imbalances are suspected, a discussion with an endocrinologist might be beneficial. Remember, your medical team is there to help you find solutions that support both your health and your quality of life. Building on our earlier discussion about redefining intimacy, let's explore this concept even deeper. Intimacy is a multifaceted experience that engages all our senses and emotions. Focus on sensory engagement, beyond genital touch. Explore comforting and reassuring touch on other parts of the body. Think about the power of smell, aromatherapy, perfumes, or simply the natural scent of your partner. Create a romantic ambiance with soft lighting or candles. Use sound, music, whispered words, or shared laughter to enhance the experience. Michel and Sarah started having date nights at home, just talking, laughing, and holding hands, rediscovering the emotional closeness that had been overshadowed by the stroke. This leads us to emotional intimacy. Share your feelings, dreams, and even your fears with your partner. Spend quality time together, engaging in hobbies or activities you both enjoy. Humor and playfulness can also bring immense joy and connection. Remember, this is a journey of patience and experimentation. It's about learning what works for your new body and your new relationship dynamic. Be flexible, creative, and gentle with yourselves. There might be awkward moments, but approach them with mutual understanding and support. Every small success, every moment of shared connection, is a victory. No one should go through this journey alone. Your support system is invaluable. The unwavering support of your partner, like Sarah's for Michelle, is often the most crucial. Family and friends who offer understanding and non-judgmental support can also make a significant difference. Beyond personal connections, a multidisciplinary medical team is essential. Your physical therapist can help with mobility and strength, which directly impacts comfort during intimacy. An occupational therapist can provide adaptive techniques for daily activities and suggest aids. A speech therapist can assist with communication, which, as we discussed, is vital for intimacy. Crucially, a psychologist or sex therapist can address the emotional and sexual health aspects. And, of course, your neurologist and primary care physician will manage your overall medical condition. Michelle's journey was significantly bolstered by Sarah's unwavering support and the expert guidance of his medical team, including a specialized sex therapist who provided tailored advice and strategies. Remember, leveraging these resources means you don't have to carry this burden by yourself. As you embark on this journey, it's helpful to be aware of some common pitfalls. First, ignoring the issue or pretending it doesn't exist. This only builds resentment and distance. Second, assuming intimacy is impossible or over forever. While it changes, it's rarely gone entirely. Third, not communicating with your partner. Silence is the enemy of intimacy. Fourth, not discussing side effects with your doctor. You might be missing out on simple solutions. Fifth, comparing current intimacy to pre-stroke intimacy. Your body and relationship have changed. Embrace the new normal. Sixth, pressuring oneself or one's partner. This creates anxiety and makes intimacy less enjoyable. Finally, isolation and not seeking support. Remember Michelle's story. Reaching out to Sarah and his medical team was his turning point. Avoiding these mistakes will pave a smoother path to rediscovering intimacy. To recap, recovering intimacy after a stroke is a complex but achievable journey. We've learned that a stroke impacts sexual function physically, psychologically, and through medication side effects. The right mindset, open communication with your partner, and a willingness to redefine intimacy are your first, most powerful tools. Practical strategies for physical challenges, proactive steps to address psychological barriers, and transparent discussions about medication with your healthcare team are all crucial. Remember, intimacy is broad and beautiful, extending far beyond specific acts. Embrace sensory and emotional connection, and always seek support from your partner and a multidisciplinary team of professionals. Michelle's journey exemplifies that with patience, communication, and the right support, reclaiming a fulfilling intimate life is absolutely possible. This journey might not be easy, but you are not alone. In our upcoming videos, we will delve deeper into specific foods that can support overall health and intimacy, and simple exercises you can start right at home. Your well-being, including your intimate life, is a priority. Please hit the subscribe button and turn on notifications so you don't miss out on these valuable upcoming insights. Share this video with anyone who might benefit, and leave your questions or experiences in the comments below. We are here to support you every step of the way. Thank you for joining us today. Remember, recovery is a holistic process, and reclaiming your intimate life is a beautiful and important part of it. Stay strong, stay hopeful, and keep moving forward. We look forward to seeing you in our next video.